The numbers don't lie. Today we have not one, but two data experts here to talk about why data is so important in public health and give some examples of where it's made a difference in people's lives. We play some games, you know we like to do that, and also check out the FCPH Data Hub to learn more about what's happening in our communities. So what do you think? Last year, did Franklin County have more or less than 18 days with heavy precipitation? Find out the answer to that and more coming up on Health is Real.
Come on in, stay a while. Andrew Stinson here alongside Zach Watson and Angela Taw. The name of the podcast is Health is Real from Franklin County Public Health, coming to you from Memorial Hall in downtown Columbus. Zach Watson, how's it going today?
You know, as I sort of awoke on this really gray and dreary Ohio morning, went downstairs and prepared my breakfast, a dish of exactly 34 almonds, checked my email inbox, totaling about 22 unread emails, hopped in my 2017 Honda Accord Touring Edition, and just drove here. And I just thought to myself, I just am so excited to be here.
All right.
Do you want me to just say good?
All right, Angela, do you have a more reasonable response to that question?
Yeah, I'm doing great. Happy to be here, and I don't have my life story to give you right now.
You know what? That's okay. I love hearing the life stories, but I also want to bring in our guest today. That is Sierra McEachran. She is the epidemiology supervisor here at Franklin County Public Health. How's it going, Sierra?
It's great. I'm fantastic. Happy to be here.
Wonderful, wonderful. Now, so you work in epidemiology, and I've been here for about a year. And a year ago, I probably couldn't even spell epidemiology. That's how little I knew about it. Can you tell the folks at home a little bit about what epidemiology is?
Definitely. And I think most people are on the same page as you. A lot of people I meet think epidemiology has to do with the feet for the first time. So no foot science and epidemiology here. To put it simply, epidemiology is the study of the distribution of health outcomes in a population. So kind of that who, why, what, where behind population health outcomes. You'll hear them epidemiologists called disease detectives sometimes. So that gives you a little insight into what epidemiologists do.
I love that. And obviously, we work in public health, but can you tell us maybe, is there other fields that you would find epidemiologists in?
Yeah, definitely. So epidemiologists work all over the place in all different kinds of fields, obviously government, state, local, and federal government. Also universities, research institutions, consulting companies, and private companies as well. So I would bet that Disney World, for example, has an epidemiologist on their staff.
Interesting. Would have never guessed that.
Yeah, I wouldn't have guessed that either.
So tell us, why are you an epidemiologist in public health? What sort of brought you to the field?
Yeah, absolutely. So I studied public health. That was my background anyway, and kind of my foundation in my learning. And as far as working at the local level, I really care deeply about making a local impact and working closely with the communities that I serve. So that's why I'm here.
Yeah, and so we receive data requests from the public sometimes, right? What kind of requests do you get? I mean, I'm sure there's a wide variety, but what sorts of things do we typically hear from the public to request?
Yeah, and you have it right. Definitely a wide variety. Depends on where that request is coming from. We've received requests related to birth data and birth outcomes. That's a big one of interest for the community. Injuries. So a lot of people are interested in injuries and injury rates to help inform some prevention efforts throughout the community. And things like tobacco use too. That's a big interest for community members when we get our external data requests.
So that's a lot of projects that you guys are working on, a lot of different data points that you're touching. What would you say in the past year has been your favorite project you've gotten to work on?
Ooh, my number one favorite. It's a good question. I think I have to say the Franklin County Public Health Data Hub, if I have to pick one.
Cool.
That was a big initiative with our data committee and our wonderful communications team and many other staff throughout the agency. And really the focus there was data transparency. So how do we ensure that the community has access to data and can use it, and anyone can really find all of the data resources that our epidemiology team uses all of the time. So I love a lot of the projects I work on, but I think I have to pick that one if I pick one.
Awesome.
And when she says communication team, she means me. I will not let you two. I will not let you two leech off of my accomplishments. It was great to work with you on that, Sierra. I was hoping you would say that. I feel very good about that. So, what are some of the biggest challenges in both epidemiology and with sort of data collection, distribution, everything that you do?
Yeah, so a few different challenges. I think at the local level, a big one that comes up is small numbers. So when we're looking at these really important health outcomes, but we're looking at them in one zip code, for example, sometimes those small numbers just don't tell us enough of a picture. And I think that's where some getting creative with data can come in. So you think about like focus groups or that qualitative data and really listening to people's stories. We recognize that as data too. And so that can supplement some of those small numbers issues at the local level, for example.
All right. And obviously data is essential to public health. Can you describe why that is? Why is data so necessary in the field of public health?
Yeah, that's a great question. Of course, I think it's necessary as an epidemiologist. I think it's really important to look at the numbers and make sure that that's guiding our work. When we think of public health and we think of all of these different health outcomes, all of these different communities, and all of these different ways we could navigate an issue, I think sometimes data tells us the most impactful or most effective way that we could go about doing that. And that's why it's important. I think we have a lot of options and a lot of resources at our fingertips, but data will tell us how to make the biggest impact and where to allocate those resources so that we're working to impact the community positively, especially when we think about health disparities.
What are some tips for the public when interpreting data, Sierra?
Yeah, that's a hard question. I think just really relying on trustworthy sources. So, for example, your local public health departments, and making sure that the folks you're consuming data from are reliable sources of information can be really important. Data has a lot of power and you can interpret it a lot of different ways, which is wonderful and also can be challenging. And so I think, again, just making sure that your sources are reliable and that you have a full understanding of the data that you're consuming before you use it to make choices and decisions for your health.
So data is important. Like, obviously numbers don't lie, but people do, right? It's difficult to...
That's great. Sorry. Keep going.
That got a reaction from the crowd. But I think data isn't always easy to interpret. So people can come to their own conclusions, sometimes the wrong conclusions when looking at data. How do epidemiologists take that into account in their work?
Yeah, so we really try to focus on data numeracy. We try to think about how do we make sure that the way that we're interpreting data is understandable to the public. And so a couple of different ways we go about that is looking at reading levels, for example, so making sure that the interpretations we're putting out there are readable, that, you know, our numbers are rounded to one digit, for example, if that still makes sense and it's easier for people to consume. So we have a lot of practices in our office that focus on ways to make sure that people can really understand our data to the best of their ability. We also focus a lot on data visualization. So that's something we've been really working on for the past couple of years now. How do we make sure that the graphs and charts and all that we're using communicate the data to the best of our ability? And typically when things are visually appealing, I feel like they're easier to understand as well. So that's something we've been working on a lot and continue to work on in our office.
Since we're talking about graphs and data visualization, I have a game, something that Zach got signed up for that he doesn't know about. The fear in his eyes.
Here we go.
So we have a graph game. I have a list of 11 types of graphs. Some are real, some are fake, and you two are going head to head to tell me which ones are real and which ones are not. All right, so are you ready?
No.
Yes. So exciting. Talking about
Sounds
graphs
good.
and charts.
Yay. The first graph, is it real or fake? Bar graph.
Real.
Real.
True. Good job. Great job, guys.
One for
that was
one.
an easy one. All right, second one. A matrix chart.
Real.
Real.
No. All right, we're gonna make
Zach has
Zach
to go
answer
first.
first.
Oh, I see.
All
This
right,
is a
fine.
public humiliation exercise.
Not if you get them right.
All right, Zach, is a mountain chart real? No, look at don't look at Sierra.
No. No, it's not
Sierra,
real.
is it real?
That's correct. It's fake.
Yay, you
Though
both got
I
it
will
right.
say there are plenty of charts that kind of look like mountain ranges. Check out a ridge plot. So that was a good one.
Thank you.
Way to drop that in. I like that. That's great.
All right, Zach, is a bee swarm chart real?
Yes.
Sierra, is it real?
Yes, that's real.
Yes.
Yay.
All right.
All right, Zach, is a scatter plot real?
Yes.
Yes.
Good job, guys. Crushing it.
I am sweating. This is
You're doing great
unfair.
so far.
You are.
You are.
You haven't missed one yet. All right, now let's see. Oh, okay. Is a pancake chart real?
No.
No,
Sierra?
it's not. That's correct.
Oh God, I'm in a prison of my own mind. Let's do this.
All right, Zach. Horizon chart.
Ooh, a tricky one.
Real.
Yes, that's real.
Yay, Zach, you're doing so good.
Zach, you're a secret data visualization expert over here.
Yes, he is.
Never
We
had
can't
this
stress
much-
enough. Zach had no idea.
I've never been this lucky in my entire life.
All right, Zach. A sunset chart.
Oh, this is torture. No, I'm gonna say no.
No, it's not.
Oh my God.
Look at you.
Wow. I really thought you'd do worse at this.
We should have got harder ones.
I know, seriously. All right, how about a bump
When
chart?
does this end?
We have a couple more.
We have 75 more.
Shit. What was it again? I'm
a
sorry.
bump chart.
Oh my God. Not real.
That one's real.
No, man.
It's okay. All streaks die.
All right, how about a starburst chart?
Oh, you've got to be kidding me. Not real.
No, that one's not real. So a sunburst chart.
Hey.
Whole different story.
Starburst, sunburst, he was close. We're trying to throw you.
We're trying to. All right, last one. A slope chart.
That's got to be real.
Yes, that one's real.
Yay.
I think you only
Okay.
missed one.
You only missed one,
Yeah,
Zach.
Look at that.
I don't know how that happened. I just blacked out for the entire exercise.
Yay.
This is a long
really-
applause. A lot of applause for you there.
Thank you, live studio audience that's clearly here in this room. I have. Do we have any other segments? Or I have a surprise segment planned.
We know you always do. So
Yeah.
go for it, Zach.
So, we don't often get a numbers expert, a numbers wizard, a data wizard, if you will. So I want to talk to you about some numbers and songs, and I just want to see if you can give me some insights. It was famously proclaimed in music that 1 is the loneliest number. Can you speak to that? Nothing?
Let me take a second to think on that one.
well, what would be a lonelier number, right? What would be the lonelier number than
I guess
one?
that's true. Well, you know what? We'll just move on. Lou Bega once famously had a song Mambo Number 5.
Yes.
What happened to Mambo's number 1 through 4?
Great question.
Oh, Zach.
I'm sorry, Zach. I don't have an answer. I'm trying to think of something creative and fun. And nothing's coming to my head.
The White Stripes famously have a hit song, 7 Nation Army. Please name those nations.
I can't, but I do like that song. It's a classic.
I'm done torturing you now. You don't have to do this anymore. You're far too important for this.
Fear in her
I'm
eyes.
sorry.
with each question.
I really wanted to be witty and have a
You're
fun
good.
retort, but
You're good.
I didn't.
It's all good. That's because you never know what's coming from Zach.
I felt so not in control for that entire game that I was like, okay, let me get back in
Did
control.
you just come up with that on the spot?
Yes.
Oh, wow. What do you think happened to numbers 1 through 5?
He probably didn't like them as much or something, or I don't know. Maybe he just sort of like noodled on 1 through 4. He's like, this doesn't sound right. And he was like, oh, Mambo number 5.
When he got to 5, he was like,
Yeah.
this is it.
Yeah,
Mm.
I think
Fifth
so.
iteration, yeah.
Yeah.
We'll have to get Lou Bega on the podcast and ask him ourselves.
Oh, I would love that.
Yeah,
Not as much as you being here, Sierra, but I would love that.
Thank you. I'm flattered.
Lou Bega, strong second. Sorry, Lou.
Well-
And everyone else we've interviewed.
Oh, yeah, sorry. Whoops. I love the rest of you too. Lou's just really great.
And on that note, Sierra McEachran, she is the epidemiology supervisor here at Franklin County Public Health. Thank you so much for coming on our podcast and having some fun with us today, Sierra.
Thank you so much for having me.
Thank you again to Sierra McEachran, a wonderful interview. And we're excited. We have a second guest today, guys. Can you believe that? A second guest.
Wild.
We're moving up in the world. Alex Evans is here. He's an epidemiologist at Franklin County Public Health. How's it going today, Alex?
Good. How are you guys doing?
We're doing great.
Great.
I'll speak for all three of us. We're doing wonderful. So, Alex, how did you find your way here to FCPH?
Yeah, so actually I studied a few different things in college, but epidemiology was obviously my primary interest. After I finished grad school, I worked for 2 years at the Centers for Disease Control and Prevention. And in that role, I worked really closely with a lot of different state and local health departments. So I spent a lot of that time in Cincinnati with the city health department there, and part of that time in Kentucky with the state health department there. So even though I was a Fed, so to say, I still got to see what public health looked like at the federal, state, and local levels. And then after about 2 years, I kind of wanted to move a little bit closer to home, which for me is Northeast Ohio, and also was starting to look at going back to school for my PhD. And so right around the summer of 2019, I had the chance to take this role or go back to school. And I think I made the right choice because obviously, 5.5 years later, I'm still here and love my job and have been lucky enough to have the chance to pursue my PhD kind of on the side.
Nice. That's awesome. What can you tell us a little bit about what your PhD focus is?
Yeah, so my PhD is in epidemiology, just kind of learning more about that and getting into my dissertation, looking at how prescription drug monitoring programs impact prescription opioid misuse in adolescents.
Very cool. So you often do a lot of our data for our environmental health section. That's not all you do, obviously, but that's where you've been for the past 5 years. Can you talk about why data is so important when it comes to environmental health?
Yeah, so data in environmental public health are just as important as data in like every other area of public health. So if you think about the water that you drank this morning or the air that you're breathing now, like we know that that's safe to drink or breathe because someone is paying attention to potential contaminants or pollutants that could be there. And so without regularly collecting data to monitor the safety of things like the water we drink and the air we breathe, we really wouldn't know that they're safe. Think about your favorite restaurant, pizza places that you like to go to. If you go swimming in public pools or if you've ever gotten a tattoo, nobody that goes to places like that wants to come home with an infection or diarrhea. So the public health programs, our inspectors go out, visit those places, collect data during the inspections, and make sure that they're operating safely. And then my role, oftentimes, like you mentioned, is kind of looking at that inspection data and figuring out how we can do something a little bit more with it to make those places even safer.
Yeah, and that's a great answer. Just very thorough. And I would just have to ask, so I know you just provided like multiple examples of this, but do you have any other examples of where data has sort of made a difference in other people's lives?
Yeah, so a lot of my work is sort of upstream from direct effects on people's lives. So if you think of the health inspector going out to a restaurant, they might see some food that's been sitting out too long or it's been sitting out and not held at the correct temperature. So they can have that food discarded so that it's not served to customers, and they can kind of directly prevent potential foodborne illness cases by preventing someone from eating that food. And like I said, my work is really a little bit more upstream, kind of you could say has some trickle down effects on people's lives. And so oftentimes I'm doing data analysis to sort of inform or help other programs kind of prioritize certain populations or certain geographies where they might want to focus different program activities or different interventions. Oftentimes I'm doing, data analysis to help support responses to certain events. Like last summer we had two extreme heat events, two heat waves. So doing, data analysis, monitoring emergency department visits for extreme, conditions related to extreme heat, that sort of stuff. One specific example, I guess, is the food safety grant that we have. So over the last 4 or 5 years, we've received about $1 million from the CDC to do practice-based food safety research. And so that really is taking the inspection data that we're already collecting through our regular activities, looking at how we can sort of analyze that further. And one of the things that we've been kind of looking at through one of our research projects is evaluating certain training requirements for managers, food safety training requirements. I guess it's not so new anymore, but this was a new requirement in 2019. So we've been kind of evaluating the impact that those requirements can have on inspections, and then also looking at some other characteristics like whether that training was completed online versus in person, a couple other characteristics. And unfortunately, I can't share results of that yet. We're working on publishing a few papers, but at some point later this year, I'll be coming to you guys to help get the word out about what we found and how that can make a difference in people's lives.
More to come.
Nice. Absolutely. Looking forward to that. Now, we wanted to ask you about climate change. Is that, I know you track a lot of different sorts of data. Is that something that you find a lot of people are interested in? It's such an important subject.
Yeah, that's a great question, and I think so. And certainly, I've become more interested in tracking data related to climate and health over the last couple years. And for me, and I think the health department, it's not just kind of tracking climate changes, but also tracking how those changes relate back to public health and the work that we do. So about 6 months ago, we launched the climate and health page on the data dashboard. We're tracking, metrics like air quality, heavy precipitation events, extreme heat events. But we're also tracking, the health-related outcomes like asthma and allergic conditions, infectious diseases spread by ticks and mosquitoes, as well as, those conditions that are caused by extreme heat. So this is really basic public health surveillance that we've typically applied to other areas like infectious disease or just tracking, births and deaths. So the idea is really by tracking these metrics over time, we can have a better understanding of how climate is changing and also how that is affecting, our work in public health.
So you've mentioned a lot of different pieces of data that you track, a lot of surveillance that is out there. In your opinion, what would you say is the most important piece of data that you guys track?
So it's a tough question, and I don't want to take the cop-out answer, but I'm going to say that there probably isn't one individual or, source or data point that I would say is more important, and that's really because when you start putting multiple different data points together, the whole really becomes, more valuable than kind of the sum of the individual parts. And so
Sure.
to kind of illustrate that, if you take asthma as an example, we can come up with how many, people went to the emergency department last year for asthma or asthma attacks, right? And so that in and of itself, just having that number is, tells us something, but really doesn't tell us much. And so then if we pull in zip codes, we can kind of, separate rather than one count for the county, we can have a count for each zip code, right? And that tells us a little bit more information. And then at the zip code level, we can pull in population data, we can pull in other demographic data, we can pull in, social and economic data, and we can calculate rates, which helps us compare zip codes better than just looking at numbers. We can start to understand how emergency department visits relate to some of those social and economic factors. And then we can also pull in other things like air quality or, tree canopy or proximity to highways or, whatever else you can think of. And then we really get to paint a much more complex but much more useful picture for the work that we do related to asthma. So, it's all really important. And, as an epidemiologist, I'm kind of a little bit biased just because we're always looking for, more and more data.
Yeah. So I have to ask, what are some of the what challenges do you see with data in environmental health?
Yeah, so there's two big challenges that I can kind of think of, and these are not really specific to our environmental health program, but really kind of environmental health in general. And I guess the first would be sort of data modernization. And this is important because the data that we collect really needs to be reliable, and that means that it's complete, that the records are complete, and they're not just complete, but they're also accurate. right? And so that's obviously important. But then the data also need to be accessible. So that means that they're easy for us to access and use to answer questions for ourselves, but also if we're collaborating with external people or academic partners, we need to be able to easily get them access to the data. And that also means, if we wanted to combine restaurant inspection data from every local health department in the country, that would be really great. And we could probably answer some really important research questions. But the reason we don't have that right now is because every state and sometimes even counties can have different software, different databases. They have different food codes, so that can impact what data they collect and how they collect it. And those systems, databases, software programs aren't usually designed to talk to each other. So trying to kind of combine data is definitely a big barrier, I think. And then also, beyond that, even using the data for ourselves, some health departments are still doing inspections on paper forms, and that, even just looking at your own data then becomes burdensome because it's not readily accessible. And I guess I would say that the second barrier is probably workforce development. So, most local health departments don't have an epidemiologist or a data person that's primarily assigned to just looking at their environmental health data and going through inspections and working with those data. So, and the traditional environmental health workforce hasn't typically received a lot of, data analysis or visualization training. So there's definitely, I think, some work there for workforce development and further promoting collaboration between, the epi and data folks and environmental health.
I'm curious, what projects have you worked on that you would say you're most proud of?
There's a lot that I think I could be,
sure.
really proud of over the last 5.5 years. I think, obviously, the projects that I've mentioned, the climate and health page, the food safety grant are two big ones. But I'll mention one more, and that's probably the data hub site that we launched. Feels like it should be last year, but I think it's like a year and a half ago now.
Wow.
But this was a really big lift that involved a lot of different people from really every area of the health department to come together and bring the data and resources that they want to present. It's also something that has been in the works for several years and then was put on hold for several years because of the pandemic. So after we kind of got on the other side of that and had some time to start working on it, I think things really started moving. And I think it was just a great success story and certainly a good improvement from our previous data page.
I would agree with that. Most people don't know that I was involved in that process too. And I just wanted to take this time to just give you, the three people I would like to give endless praise on this project are you, Sierra, and then a friend of ours, Kirsten Oliver, who those conversations started with you, Kirsten Oliver, and I, like you said, pre-pandemic forever ago. And then I just want to compliment you and Sierra for just like never letting the football go, so to speak. Like you really got the ball across the end zone. I just got pulled in several different directions with COVID, but you guys really oversaw that. And it was fantastic. I love the Data Hub personally.
So I know we have a game that we're about to get to, just to, add some little flair to the interview. But I did want to ask before we got to the game, you've talked a lot about surveillance and, we are the health department and sometimes people can feel a little weird about those two things combined. Can you just maybe speak for a moment on just sort of some of the protections around people's information that we have when we're looking at some of these data points?
Yeah, so a lot of the different data sources that you might find on the Data Hub site are publicly available data. So we're doing a lot of secondary data analysis, so getting data from the U.S. Census or just other kind of publicly available surveys. There are some data that we get, so think about blood lead tests in environmental health or infectious disease data, birth and death records. Certainly, we take a great care to protect those data, and there's definitely some restrictions around what we release in terms of releasing aggregated data that can't be used to identify specific individuals.
Thank you.
All right, I heard something about a game.
That's what I heard.
But I don't know anything about this. Zach, do you have more information? Zach,
I do have more information. We're going to play a game here, Andrew. And it's going to really put you on the spot. It's going to test your knowledge
great.
of numbers
Wonderful.
and education. We can potentially even infer your IQ level based off of your answer results. I'm just kidding. So we are on the health-related indicators page for environmental health that Alex had a part in creating. And on this page, we have data for multiple topics, such as, mosquito-borne diseases and allergic diseases. And these rates are calculated per 100,000 residents, okay? So I'm going to give you a just random out there number.
Okay.
And then you're going to have to tell me if it's over or under what the actual real number I'm looking at is. So, for example, for chronic lower respiratory diseases, per 100,000 residents, the actual number is 239, so 239 per 100,000 residents. I would throw out perhaps over, under for chronic lower respiratory diseases, 450. Obviously under, given that you know the answer to that question. So
that's the one I'll get right. Yeah.
Yes. No, I will not be asking you that question. So I'm going to pick, is it okay if we do 5? Is that fine with everybody? Okay. So I'm going to pick 5 data points here, and we're just going to see how many that
Sounds
you can
good. Let's
get
do
right.
it.
All right, so let's go with tick-borne diseases per 100,000 residents, over under 12.4.
12.4 is the over under.
And that is tick-borne diseases.
I'm going to say over.
Incorrect, I'm sorry. Under at 9.5.
9.5. Okay,
Yeah.
well, that's good, right? Less tick-borne
Yeah.
diseases.
Oh, yeah. Of course. Of course.
We'll take
Good
that.
thing to
then.
be wrong about. Yeah.
All right, well, I'm 0 for 1. Not a great start.
Yes. Let's go heat-related injuries. Over under for 100,000 residents, of course. 6.2.
6.2. You know what? I'm gonna say over.
Ding, ding, ding. You are correct.
All right, got one.
Nice. It is 10.6.
I mean, not good for being
No.
more heat-borne illnesses, but good for me for getting it right.
Yes. We should just say right now, we are not taking the severity of this out of these cases by playing this game. It is mostly an awareness game for all of you to stay safe at home. But we cannot also separate the fact that this is a game and it is just very enjoyable to watch someone get something right and wrong sometimes too. All right, let's do allergic diseases. Over, under 101.
Allergic diseases. Over, under 100. I'm gonna say under.
Wrong. Over.
Oh, really?
125.
Oh, wow.
Over, under days with heavy precipitation. 18.
And this is Franklin County, right? Days with heavy precipitation. 18. Now, what is heavy precipitation? Does it say what that means? Is it a certain amount of rain?
Yeah, so for this metric, we defined it as 0.75 inches of rain or more in a single day.
Okay, excellent. That's very helpful, although I still probably will get it wrong. I'm going to say over.
Incorrect. Under at 14.
14. Okay. I wasn't, yeah.
I'm really Price is Righting you.
Before we move on to the next one, can you see how that compares? Because I feel like it's been a lot rainier this past year. Than
So over
years
the past 5 years,
Yeah.
let's see. In 2023, we're at 14. 2022 at 17. 2021, 15. The highest one by far is 2020 at 21, as if 2020 wasn't hard enough already.
We had to have a ton of rain on top of that.
Yeah, love that for everybody.
It's nice that you can see how that has changed over the past couple of years on that metric as well.
You can always track the amount of change across years on the Data Hub because it is a miracle website that you, your friends, your family should go to at all times. SCPH Data Hub. Last question. Let's go with the opposite end of the spectrum. Over under the number of heat index days, and just to clarify, this metric tracks the number of days each year where the maximum heat index was 95 degrees Fahrenheit or higher. Over under 8.
I love the dramatic pause.
I'm going to say $1, Bob. No. I'm going to say over.
Ding, ding, ding. You are correct.
All right.
9.
Oh, that was close. Yeah.
I like to trick you.
Okay.
Yeah, so congratulations. 2 out of 5.
2 out of 5.
Yay.
That's not bad.
40%. I'll take it.
So somebody needs to
Snaps
spend
me.
some more time looking at the data hub.
I know.
Yeah.
I know.
I'm bad with repeating numbers in general. The dramatic pauses were mostly due to a lack. I'm like, wait, what's the number again? Like,
No, I
don't
like
remember
the
number.
pauses. That's
Yeah.
great.
But yeah, I did not know about these current past 5 years, like boxes or whatever.
But if you go to the next tab, you can see a lot of them back to 1948.
Whoa.
Wow.
That's so interesting.
Oh, trend. Oh my God. Yeah. Yes.
I
There's
love
a trend graph.
Especially when you can see it like graphic, like in a graph. Oh, I love that. I have this app called Storygraph to track my reading, and it
Oh,
puts
that's nice.
all of these different things in graphs. Oh, I love it. It's so fun.
We're a very pro-graph
Yes.
podcast.
Yes, that's why we work at the health department.
Absolutely. Alex Evans, epidemiologist here at Franklin County Public Health. Alex, thank you so much for taking the time and coming on the podcast today.
Of course, thank you.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.